Jim. Welcome.
Hey, good to see you, Dr. Barnes.
Always good to see you. This is Jim Thomas. He's an expert in attachment and addiction, an international speaker, and really an expert in emotional focused therapy, and someone that we've worked with some mutual clients and someone that I respect greatly. So I'm really glad to get this chance to talk.
Yeah, it's good to talk with you too. We were having a conversation, right? We were talking about your work up at the Foundry. Dr. Barnes, Mike is the chief clinical officer at the Foundry in Steamboat Springs. Great program if you need to refer someone for residential treatment for addiction and trauma. And you've worked with a bunch of places like Cedar and 35 years. I think we're both about 35 years, man. This is passage of time. But we were talking about the concept of codependence versus, and you said, let's keep talking and share some ideas for people that maybe might be useful that listeners will find.
You know, it's so interesting. In our last conversation, I was so taken by, so often in addiction treatment, we see the things that family members do that is really a sign of attachment and things that people who are attached would do, and to make sure that someone they love, survives and is.
Right. Think about any other sort of condition, disorder, struggle, disease, however you view like addiction or alcoholism, etc. Right? Because some of these labels we're finding are not useful to people, right? When we say like alcoholic and addict, there's some chunk of people that actually then resist going to treatment. Help me understand what I'm struggling with. And I think we do the same thing when we say like co-addict, codependent. You're codependent on this person, and your love for them and your care for them and your desire to try to somehow be there for them and help them with this thing they're struggling with is a condition or a disease or a disorder in and of itself. I think what you just mentioned is powerful. That when I think about it, it's like, what would a parent do with an ill child that's struggling to take care of themselves in the illness, right? The kid's got a fever and they want to go run outside and play without their coat, and they don't want to take their medicine, and they don't want to eat this, chicken soup that, grandma says will really help. Well, the parent tries to talk with them and cajole them and encourage them to take care of themselves. So I fall in love with somebody, or I have an adult child or my partner that's, falling into the struggle with alcohol or substance or something, and my care for them and a lot of these attempts to plead with them, talk with them, accommodate them, try to stay connected with them. I think what you're saying, and you and I agree on, is if we look at those as attachment-driven behaviors, they start to make more sense. Of course, and if it was something else, if it was depression, if it was, adult onset diabetes, if it was, we would be probably more understanding and say, of course you worry that, with his blood sugar, he shouldn't be eating chocolate cake all the time, and that bothers you, and you don't want him to die young. But somehow, because it's a substance, we've almost like labeled it or criminalized it or something, and now people come into these programs and they're often taught, boundaries and distance. So you go do your program, I'll do my program. And I think I find the more I work with people, when you deconstruct that and say, well, of course you care about them. Let's find a way to care about them that helps both of you and can strengthen your relationship, because your relationship is a resource for this person that's struggling. You're struggling too. Let's be in the struggle together. Project I think like a Carl Rogers or Fred Rogers would approach it. Right? Of course, you're having a hard time, Michael. Your partner drinks a lot and they disappear at night. They fall asleep or they get angry. It's hard for you and you care about them. Let's figure out what to do with that caring.
It's so interesting. I found a paper that I had written back in 1991, and it was about, like, is there a need for a paradigm shift in addiction treatment to treat families differently? And I read the paper and I thought, we're not any further along in this process, 30 years later. And so, that idea of, we do divide families in traditional addiction treatment. And it's that, if he would just get sober, then we could go back to normal. And so, I've been
Well,
doing.
he has to work on that, or she or they by
Sure.
themselves over there in their magic treatment world, and then come back home at some point, fixed, cured, whole, healthy. And that's not the lived reality of most people.
No, it's really not. And so, like, that's one of the things that I really was taken by your comment, and you just explained it beautifully, that idea that it's so different in many cases in the traditional addiction setting. It's like enabling is seen as being dysfunctional across the board, as opposed to, it's a sign of attachment. It's what we would do when we love someone. I think about the days of strategic therapy where the solution has become the problem kind of thinking, and that I've been spending a lot of time thinking about how we help families begin to understand that while we can love someone, that the solution and the way we do it, and how we understand it, can actually be more divisive than it is healing. And so,
Right.
how do we move families into that family healing process?
Yeah, and of course, like, it doesn't mean now, if you're listening or you're a clinician, you're listening and you're in a relationship, like you're in Al-Anon, right? Because you have a friend or a family member. We don't mean by this you're now responsible for their drinking, or you cause their drinking, or you have to hold them accountable for their drinking. I think the nuance for me that's so powerful is, how can I foster a deeper, stronger, and paradoxically maybe a more emotionally vulnerable connection, um, and take, so here's a person of concern that's struggling with a substance or alcohol, and oh, think about it in attachment terms. We're both attachment people, right?
Yep.
That there is attachment realities in people's lives, and so often when you go into addiction programs and intensive outpatient or in a private practice or something, there's so often, as you well know, trauma, adverse childhood experiences, pain that's being dealt with, numbed out or distracted, et cetera, by the substance or process addiction. And then the way the family or couple is trying to deal with it is causing more pain. And so I think there's this instinct, it kind of has this common sense vibe to it that, like, well, what we ought to do, they're causing so much pain with each other, let's separate them. And I think when you bring up the whole family therapy field, this late 60s into the 70s and early 80s was so much, let's bring families together and help them reorganize and function in a different way around whatever their presenting problem is.
Mm-hmm.
And maybe we ought to make it relational. And when I think about, I think we're learning this about trauma. And I love that you said you wrote that paper in like 1990. I did one around that same time for my master's paper. It was about addiction treatment through a family therapy lens, and how little there was about how to include the family beyond like psychoeducation and boundary making, right? And so I think about the Dr. Bruce Perry, you're familiar with, the trauma neuropsychology guy, in probably 98 in Denver, giving a full day, great workshop, showing trauma in the brain and stuff. And I'll never forget how he concluded. He said, and in conclusion, the most biological intervention available to us for trauma is healthy relationship.
Mm-hmm.
And it's true for addiction. And so it's like, how do we foster that while people can maintain healthy boundaries, right? Not going out and rescuing people. Some of these things are valid points, but when we take them to extreme, it's like, how can I say to you, I love you and I'm here, And my concern for you, like in a loving intervention, I have concern for you. I see that you're overwhelmed and under-resourced and your executive functioning is a mess, and this substance is taking you away from me. And by saying to you, look how you're hurting me, I just flood you more. But if I say to you, I'm missing you, where are you going? Where do you end up when you're doing this? Come home. And for me, I kind of summarize it up. People go, what is it? What is this whole approach about? And I said, it's kind of like the family learning to say, like hide and seek, ollie ollie income free. And if a program is helping me come back to the people that care about me, what do we know about our success rates? They go up. You can help me reconnect with my family instead of I've gone off to the magical program, done all my treatment, and now I'm coming back into the same system. And
That's no different.
That's no different. And how can we connect through this struggle in a way that I'm not responsible for your not drinking or using or not using, but I move into being an attachment resource rather than just a trigger.
I so often when I talk to family members about like enabling, and they'll talk about, well, when I know it's that time of the month, when I need to pay, he's going to come for that money to pay the rent, and everyone's been telling me not to do it, and he's angry, and they talk about like the tightening of the chest and the throat closing and the fight or flight response into a state of dissociation as they just say, here's the check for the money. And I often think about that idea of, I think codependency is really a developmental trauma, meaning that it's a relational representation of that kind of childhood trauma, the lack of attunement to needs, the lack of feeling empowered to make decisions, and that it, if you look at the symptoms of developmental trauma and codependency side by side, they look the same.
They sync up, right?
And so, how do you? I'm curious with your view, the EFT view, that idea of, it looks to me like it's really a trauma response at the reality that if I don't do this, he's going to die, or if I don't do this, he's going to be homeless. And
yeah, that's right. I think, Mike, you're just onto something so important that for families and friends, partners, and for clinicians and programs, to put yourself in those shoes, to imagine saying no and wondering if they're going to die. I worked with a fellow who was trying to get his adult child back to a program out of state, and they had a layover, and this adult child is sort of like decompensating with the idea of going back, and it turns out later it's all shame. I had to go back with my tail between my legs, and the program was teaching boundaries. So he calls and he says, what should I do? He's out in the corner like crying and screaming, and like, well, he's got to make choices. And this father saying, I couldn't do it. I had to go, and I got by him, and I just sat with him, and he started yelling about, you never, were there for me. And I thought, oh, this is that stinking thinking. And he said, but there was a golden thread of truth, Joe. And I just decided to listen in all the craziness to the golden thread of truth. And I got his attention, and I said, son, it's so true in so many ways that I wasn't there for you when you were younger, but I'm here for you now. And he goes, well, leave me the fuck alone. And he says, that's the one thing I can no longer do. And he says, Jim, within 10 seconds, I watched my son's breathing slow down. He grabbed my hand. He held my hand. He started crying. And out came, I don't want to go back there. I'm a loser. I'm a loser. They all know I'm a loser. I'm going back with you. Will you walk in with me? I can walk in with you. Would you stay? Can you stay like the night and come see me the next morning? I can stay the night and come see you the next morning. Okay, Dad. We better go. We're about to miss our flight. He said, I couldn't tell the program. I didn't know how to tell them that, like, boundaries didn't fit for me then. That didn't feel like enabling or rescuing for me. That felt like being there in his trauma, in his chaos, and that, and doing a developmental repair. And who's best to do it but a father or a mother or an aunt, an uncle, a grandparent, a step parent, a foster parent is always the most powerful. Right? It's great if we need to do it. The clinician or the program is better than no one doing it, or we do it as a bridge. Let's have a developmental repair here. So you start to believe in people again, and then how do we include your family in a way that we're all repairing? That's kind of how I think about it. Is this again like the attachment opportunities? The bonds are there. People care. I was talking to another a program, and the clinical admissions person, was saying, this dad keeps calling up and yelling about the expense of the program. 3-4 times a week, the expense of the program, and he just doesn't give a shit about his son anymore, and he's calling again. And I say, well, what happens in the conversation? Well, he does start asking, is he getting any better? And I said, the next time he calls, just ask, say, you must be so scared that you're wasting your money. Yeah, I'm wasting my money. And I said, then when he's, say, because you don't want to lose your son. I don't want to lose my son. That's right. He starts crying, and that the conversation changes. The money's true. I mean, these programs are expensive, but it wasn't. It was the socially acceptable, gender congruent father role thing he could call. And when the program heard the heart, the whole thing changed.
Yeah.
I noticed, Dad, you haven't come out for family weekend. Mom and the siblings have come out. It's changing the conversation to bring it back to the heart. And I think when you talk about developmental trauma, codependence, all these things, it's like we're doing the best we can when we haven't experienced security with each other, when we don't have that like secure emotional bond or secure attachment. I'm an avoidance, you're anxious, you're fearful avoidant, we're triggering each other. And then the addiction itself becomes a trauma in the family. What the frick is happening here? I'm losing my person to oxy, to meth, to heroin, to alcohol, to pot. It's a hard one for parents to explain, well, pot's legal, it's not that big a deal. Well, it is for my 22-year-old. They're gone. I don't know them anymore. They're smoking it every day, and it's strong stuff. So that's where I go. I go to like, what's the opportunity in this to get people to have a deeper connection in the midst of this thing that if it was cancer, if it was depression, if it was anything other than substances or process addiction, I think we would look at it differently.
Well, and I think that, a guy by the name of Roland, who's a sort of a medical family therapy guy, talks about the importance of the 3-generation assessment on the family's kind of health schemas and that idea of what is the accumulative cost of multiple generations of trauma and addiction and mental health issues, and how we sometimes make that mistake of saying, well, this person's reacting to their child's addiction, when in reality it's the ghosts of the past, and the transgenerational, like we're so far ahead in terms of our understanding of transgenerational trauma and like cultural trauma issues. I don't know that we're that much further ahead in helping family, finding the spot to move from being too educational to the point that you're talking about, to where you get to the point where they're emotionally they can take the risk to say to their addicted loved one, I'm terrified, I love you, rather than
I miss you.
I'm furious with you, which is so much easier.
Yeah, start with, I've got to get that out, right? But leading to, especially if you're, a parent or an adult partner or something, to say, I miss you. I don't know, this is scary for me. I don't want to lose you. And to more think of it, when you talked about that, I was thinking about where Dr. Mnuchin went. For people who don't know, he was voted, deemed by Psychotherapy Network or magazine back as the third most influential therapist of the 20th century, above Freud and Adler and Jung, and he, and in his last decade or so of work, and then in his trainings, in his late 70s and 80s, while he was still out presenting, he died not that long ago, and we miss him. He was talking about exactly what you're talking about, saying, let's figure out what's going on for the parents from their experience of relationship that's exaggerating or blocking or things in this relationship. And I think the core thing that what I love about if somebody goes to the Foundry versus some other programs or some of the programs that I've been working with, so one of the things I'm doing is going into programs and training or getting groups of clinicians from residential and wilderness and inpatient programs.
Sure.
And bringing this humanistic systemic attachment lens to bear is that we're talking about these things in a way that's not just educate, so we can explain how you got here, and not to shame, blame, and scold, but to say, in a sense, like Mr. Rogers would, of course you panic and do this thing, that mimics what your parent did or is reactive. Your parents did nothing, so you're going to do everything. And part of it is you'd be doing some of this stuff if you had the healthiest family ever. Because let's face it, frickin' drugs and alcohol, when people get lost in them, take people away. They hijack the very part of the brain that's wired for connection. Like Phil Flores says, an addiction is an attachment disorder. Like Jonathan Harvey says, the opposite of addiction isn't sobriety. Sobriety is on the way to connection, human connection. Oh, I'll forget the fellow's name. It was a great quote when he said, it's white knuckle until we can help the person of concern replace, addiction with deep, powerful human connection. And so that's, I think what we're doing is the person who calls, instead of codependence, it's prodependence.
Rob Weiss, yeah.
Yeah. Or if we want to close with this, I'm thinking about Dr. Mnuchin, and he came out, I had him out in 2006 for a 2-day workshop, and people kept asking him because he was very much, connection with this, his Argentinian accent. It's so beautiful to hear him talk. And people would keep, it sounds like you're fostering codependence. And on the last day in the afternoon, the last round of questions, someone stood up and said, I still think you're fostering codependence. And with that voice of his, he said, and I'll use his voice respectfully, and I knew Sal, and I don't think Sal would mind. He said, you talk about codependence, and you use this word with such venom and vitriol. If you would ask me about codependence with a little lilt in your voice, I think we could have the most lovely conversation. And he went on to say, because I have had the most codependent on each other relationship with my wife for 50 plus years now. It is the singular, most beautiful aspect of my existence. We are all here to codepend on each other. What we do as family therapists is help people codepend on each other in more fun, joyful, playful, and meaningful ways. And I think that's what you're about at the Foundry, that's what I'm about. And maybe we could talk about next time about how to move that conversation, like you said.
Yeah.
Because I think a lot of what we do is psychoeducation, and we get stuck there. That this part of the brain is like, yeah, okay, I understand it, but what do I do when they call up and say, rescue me? When they call up and say...
Well, and I think one of the things that's important to talk about is how the system is set up with insurance and HIPAA and all of the confidentiality and ethical procedures, and that the client is the client and the family is not the client. And that's why that paper I wrote in 91 was really about the paradigm shift. How do we stop that? That's
you want to talk about that next time? Like, how do we stop that, and what does it mean practically for families, clinicians, and programs? Like, what is the paradigm shift?
Yeah.
Because if we just kind of bring in the idea that we have these connections, and you do a half hour, an hour on it at family weekend, and you give information, it's just not enough to generate change, because this is deep emotional, bottom-up experiential stuff that individuals and families and couples need to experience, and in group. You can do this in group therapy, and yeah, but I'd love to talk to you more about that.